It's great. It's even better. It's fun.
All right, good morning, everyone. Thanks for showing up on time for the symposium today. My name is Greg Hager. I'm the director of the Malone Center for Engineering and Healthcare, and I'm here with Michael Miller, the director of Biomedical Engineering. And it's our pleasure to welcome you to the fourth Johns Hopkins Research Symposium on Engineering and Healthcare. And this year, as you can see, we've chosen to focus on AI and healthcare from bench to bedside. So we have a great program lined up for you today. Very much looking forward to it. I've seen it come together for the last few months, and I think it's going to be really very interesting and informative. Maybe just to say a few words to get us started. I think all of us have been reading about AI for the last couple of years now and how it's going to have impact in all sectors of society. The Computing Community Consortium recently put out a national AI roadmap where they brought together practitioners from many areas of AI to talk about what the potential is and also what the societal impacts would be. And of course, healthcare figures large in that picture of how AI is going to impact society. But I think we all know that healthcare is an incredibly diverse and complex topic. I think it's hard to believe that there's going to be a single silver bullet in one form that's going to impact AI. And so what we thought we'd like to do today is explore how this field is evolving, how people see it impacting healthcare, and in particular, how are we going to see AI move, as we say in the title, from the bench to the bedside. And I can't imagine a better partner to do that with than biomedical engineering. So the mission of the Malone Center for Engineering and Healthcare is to catalyze and accelerate the development of research-based engineering innovations that advance the effectiveness and efficiency of healthcare, really focusing very much on the systems around healthcare delivery and how we can make that more efficient and more effective. But at the same time, I have got Michael here to tell you a little bit about biomedical engineering and their mission to also advance human health. Michael, you want to say a few words about your perspective?
Thank you for all coming. Your being here makes this a great event, and doing this with Greg and the Malone Center and Biomedical Engineering together makes it a superb event. When I think about this event, we think about engineering healthcare both along with engineering the future of medicine, and being tightly coupled to the greatest biomedical science discovery institution in the world and in the School of Medicine makes this possible. I wanted to make a couple comments about the ecosystem of this, engineering healthcare and engineering the future of medicine. 2 years ago, we announced BME 2.0. This is a new curriculum educational mission. And as we think of AI, we think of intelligence, we think of our students. And when we think about machine learning and we think about learning, we think about our students. This year, we will collectively have between 800 and 1,000 students in the biomedical engineering, healthcare, Malone space. And these students are more and more computational and turning to building new technologies. This year is the first time that an entire class in biomedical engineering is doing essentially biomedical data science in the core curriculum. Every one of our students is coming through that core curriculum now. And we are jointly with the School of Medicine announcing a new AI in Medicine master's program that is focused on the clinical mission and medical students who are in their gap year. So we see collectively training our students as one of the greatest things we can do, and certainly they are the engine of our future. So with that, let us turn it over to our deans, who we are glad to have here. First, Dan Ford. Come on up. Dan Ford is the Vice Dean for Medical Education and also the Director of the ICTR and, of course, the Precision Medicine Platform. Thank you, Dan.
Thanks. Well, good morning, everyone. Thank you for inviting me here today. This is an important event for Johns Hopkins. What we'll be talking about here today will be an integral part of the future of medicine. The total public and private sector investment in healthcare AI is stunning. It is expected to reach $6.6 billion by 2021. Accenture predicts that the top AI applications may result in annual savings of $150 billion by 2026. Here at Johns Hopkins, we are already working hard in this area. There are projects across many departments in the School of Medicine, and you'll hear about some of them today. Our scientists and clinicians are developing powerful programs that can help clinicians diagnose and detect disease earlier with a great deal more accuracy. I'd like to briefly highlight a couple of these examples. The Felix project is using AI to diagnose pancreatic cancer earlier. As you know, pancreatic cancer is highly lethal. Every year, more than 50,000 Americans are diagnosed with pancreatic cancer, and 93% die within 5 years. One crucial problem is that pancreatic cancer is often detected late, when it is already spread. Working across disciplines, a group of our researchers, including Alan Ewell, Bert Vogelstein, Elliot Fishman, and others, are doing something about that. Their project combines radiology, oncology, and computer science to detect pancreatic tumors much earlier than is currently possible. They are using deep learning to spot tumors in CT scans when the tumors are still small. Currently, the program has a nearly 100% success rate in identifying a particular kind of pancreatic cancer in test images. Impressive, considering that human radiologists tend to miss some cases of this type of cancer. Another example is sepsis. Sepsis is a very different disease from pancreatic cancer, but the two share a key attribute. Often, the disease is not detected until patients have symptoms. It strikes more than 1 million Americans a year and kills more than 250,000 of them. Suchi Saria, Associate Professor of Computer Science at the Malone Center, has developed a program using machine learning that helps doctors predict which patients are developing sepsis. Researchers have found that the program to detect sepsis 24 hours earlier than experienced doctors, a significant advantage for keeping these patients alive. This system is now being used in 5 of our Johns Hopkins hospitals. We have many other projects, and you'll hear about them today. Beyond these, as an institution, Johns Hopkins Medicine has invested heavily in infrastructure that will help support all of our AI efforts. In particular, our easy-to-use precision medicine platform, which is doing a great deal to accelerate research in this area. From all of this, it's clear that AI is the future. But I want to go back into the past to talk briefly about William Osler, who is widely known as the father of modern medicine. Coincidentally, this year is the 100th anniversary of his death. Osler is one of the giants of American medicine. He was one of the 4 founding professors of Johns Hopkins Hospital. He was the first physician-in-chief, and he also played a central role in the founding of the Johns Hopkins School of Medicine in 1893. Osler's approach remains extremely relevant to what we are discussing here today. Throughout his career, he was a fervent advocate for patient-centered care, more than a century before that term even existed. Describing the need to focus relentlessly on the patient, he said, "Listen to your patient. He is telling you the diagnosis." There is an enormous amount of truth and wisdom in these 10 words. I think that if AI is going to succeed, it will have to do so by following Osler's dictum. Clinicians and patients have had prediction tools available for several decades. Even with decision support tools, those tools have not consistently led to improved patient outcomes. In developing our ideas, we must start with the patient. The title of this symposium is Bench to Bedside, but it might be better if we think about it the other way around. In framing what we want to do, we must start with the patient and his or her problems. We should look from the bedside to the bench so that we can develop innovations that solve patient-specific and concrete problems. I firmly believe this is the way forward. As such, this is an area where our close collaboration with the engineering department gives us a crucial advantage. It makes it easier for us to develop cutting-edge advances that will lead to transformations in basic science, data science, and clinical care. It is also crucial to remember that in the end, these fantastic digital advances are simply tools to help the clinician. We believe that AI can be a powerful tool, one that will help a great many people. The real key is, will our innovations help patients? It is still early, and we have an enormous amount of work to do to develop tools and strategies, and then to rigorously evaluate the effectiveness of these tools. But what we've seen so far only gives me a great sense of optimism and excitement about what we can accomplish. I'm very much looking forward to this program and hope that you will all have a chance to learn and be inspired by the work that is taking place here and elsewhere. With that, it's my pleasure to introduce my partner in engineering, Ed Schlesinger, the Benjamin D. Rome Dean of the Whiting School of Engineering.
Thank you, Dan. Thank you, Greg, Mike. It is a pleasure to welcome you all here today to this 4th annual Malone Symposium. And every year, I'm truly thrilled to see the quality and quantity of individuals who will present at the symposium, a truly impressive group spanning academia, government, and industry, leaders from Johns Hopkins and organizations far and wide. The breadth of expertise, the diversity of this group, provides clear and powerful illustrations of the innately collaborative and cross-disciplinary structure of the problems that this symposium aims at addressing. And it's also a reflection of the collaborative nature between the Malone Center, the Schools of Medicine and Engineering, the Biomedical Engineering Department, the Applied Physics Laboratory, and indeed all of Hopkins as we take on this challenge at this intersection of engineering and medicine. I think that it's important to note that this is not new in some sense for us. Johns Hopkins pioneered research and education at the interface of engineering and medicine when it established the nation's first department of biomedical engineering. And biomedical engineering has not given up its leadership position since its founding. Indeed, today, biomedical engineering, as you heard, is redefining what the field of biomedical engineering is all about, and hence the sponsorship of biomedical engineering in the Malone Symposium. I think it's also interesting to note two other points with respect to the problem and the challenge that this symposium is addressing. The first is, and it's obvious and it's been said earlier, medicine is an inherently complex problem to address. Unlike physics, something I was trained in, one cannot abstract out the complexity in order to make incremental advances. You have to live with the complexity from the get-go. And so it is interesting that today we're living at a time when the complexity, the inherent complexity, is becoming more tractable as engineering tools in computation, data analytics, health technology, systems engineering, and more is helping to advance medicine, change medicine, indeed change engineering and move it to new paradigms in monitoring of health, understanding of disease, diagnosis, and treatment. And while there has been a lot of hype about AI, and indeed I've been around long enough to have seen AI, artificial intelligence, going through several waves over time of expectation to be followed by disappointment, I think that today is different. I think that today the quantitative and qualitative tools that are available to us, driven by the scale of the data that we can take in, given by the scale and power of the computational engines we have, are putting us in a different position than we were in previous incarnations of AI. At the same time, true progress will only result from the collaboration that's aimed at solving real clinical problems, and true impact comes from grounding of theory in practice, which of course again speaks to the collaboration across engineering and medicine. And so when we look past the hype, it's clear that in the not too distant future, data-driven innovations will have an enormous impact in healthcare. And indeed, as Dan mentioned, we're already seeing the beginnings of that happening. And indeed, not only will we have tremendous impact on healthcare, we will have tremendous impact on physicians, on nurses, on healthcare systems, and most importantly, on patients. I think that today will provide an exciting look at what is possible when we work together to apply, amongst other things, artificial intelligence to the healthcare system. And so again, please accept my warm welcome to this symposium. And with that, I'll hand over the podium to Greg Hager.
Thanks, Ed. I think that really does lay out in many ways the day before us, which is to explore this interface between engineering and healthcare, and again, try to understand how we can work in this complex system, as Ed highlighted, in ways that can really advance patient care, which is ultimately, I think, why we're all here. The program today, just to give you perhaps a little bit of an arc of what we're trying to accomplish, really was designed to explore the evolving ecosystem in AI. So if you think of bench to bedside, it starts with the investigators and the work that they're doing in AI. It evolves into systems that are developed to implement technologies that those investigators create, and ultimately those systems need to be further developed and scaled and commercialized. So our program today really asks a set of questions around the development of that ecosystem. How do we develop institutional initiatives that can support AI, and what's unique about it? What is different about doing research in AI, and how can we be informed by what people are now learning as they develop new AI innovations? In the afternoon, we explore more of the commercial opportunities. What is it like to bring AI to the market, both as an established company and as a startup? So I think if you are here for the day, which I hope most of you are, you'll get a little bit of a glimpse of many different parts of the evolving AI ecosystem. And I hope you'll take a chance to interact as well, because I'm sure you came here with questions, and I think you should take this opportunity to ask those questions and hope that they're answered. So with that, I'd like to move on and give the podium over to Jeff Sewardson from Biomedical Engineering. He's going to launch our program today by introducing our keynote speaker. Jeff, please.